Assalamu alaikum wa rahmatullahi wa barakatuh. We will start talking about symptoms in the urinary tract. In this part, we will talk about symptoms arising from the upper urinary tract. The most important symptom arising from the upper urinary tract is the pain. Pain is almost present in most of the conditions arising from the upper urinary tract and causing symptoms. And now, as we know, the pain in any area of the body, it's important to know the location and to characterize the nature of the pain, also the onset and duration. And we have to ask the patient if the pain happened before, the same pain happened before or not. Regarding location, we can ask the patient to point out, for example, with one finger, the point of maximal pain, but it's important to make the distinction between pain and tenderness, because tenderness is pain with palpation. The severity also can be evaluated using scales like asking if the pain is mild, moderate, or severe, or we can use 1 to 10 scale to assess the severity. Pain in the urinary tract is generally due to either acute distension due to obstruction, or it is due to inflammation in the parenchyma of the genitourinary organ, for example, infection. Now, pain arising from the kidney or renal pain also can be due to obstruction or inflammation, such as infection. Now, renal pain has a typical location, which is the ipsilateral costovertebral angle, which is lateral to the vertebral spines and inferior to the 12th rib. If the pain is due to obstruction in the ipsilateral collecting system, the pain is going to be colicky in nature, and the colic in urinary tract is pseudocolic. So the pain will have spikes of increasing severity, then wanes down, but not reaching a pain-free intervals in between. This is the pseudocolic. And if the pain is due to inflammation or infection, then it is not going to be colicky, except if obstruction happened later on. So inflammatory pain is going to be throbbing in nature and constant and located typically in the costovertebral angle. We have also to take in mind that this location of pain can be due to conditions arising from outside the urinary tract, such as the GI system, the gastrointestinal tract, or it can be a musculoskeletal in its source. Pain due to ureter is typically due to ureteral obstruction. So obstruction in the ureter has more common or almost always is the cause of the pain. That's why the pain in the ureter is going to be acute in onset and can be located to the ipsilateral lower abdominal quadrant and to the groin, reaching to the scrotum and labium in the female. Now, the pain in the ureter, especially if we have complete obstruction, such as in the stone, will result in excessive distension of the ureter, also excessive peristalsis and muscular spasm, and both of them, the distension and the spasm, are the cause of the severe pain, or it should be called ureteral colic, but we usually call it renal colic, which is a mistaken name, because the severe pain is usually or almost always involved, the ureter is involved in the pain. Now, the reason for this referral of the pain is that the ureter is innervated from the spinal segments T11 to L2, and this will shoot this severe pain from the loin to the groin, and involving also the scrotum or labium majus in males and females. And also it may extend to the anterior part of the thigh because of the genitofemoral nerve, which is arising from the L1 to L2, and this nerve is supplying the anterior part of the thigh in addition to the scrotum and labium. Also, we can keep in mind that the cremaster reflex have the same innervation, and urethral pain may reflexively retract the testicle on the ipsilateral side due to pain in the ureter. Also, another point to mention is that if we have a stone in the vesico-urethral junction, which means the ureter inside the bladder, obstruction in that area or inflammation due to stone or gravels can also give us irritative voiding symptoms. So irritative voiding symptoms can be associated with an upper condition. Now, talking about hematuria, hematuria is merely the presence of blood in urine. It can be visualized with eye, which is gross hematuria, or it can be microscopic hematuria, which just having RBC inside the urine on analysis. Also, we have to take care that not to have a pseudo-hematuria, which means red or orange urine, but on urine analysis we will not have RBCs on microscopy. So the distinction is going to be by doing urine analysis using the microscope. Now, having gross hematuria is more alarming for the patient, so the patient will come to you earlier. While in microscopic hematuria, it can be discovered incidentally, or if the patient has another symptom. It's important, the most important points in the history with a patient with hematuria is to know the age of the patient, and if the patient has irritative symptoms or not, or if he is a smoker or not, or if he has industrial chemical exposure during his work, because we have the hematuria is an alarming sign, and urologic cancer can present up to 25% of patients, adult patients, with this symptom. So the age is one of the most important. But we have to keep in mind that also in pediatric age, pediatric population having urinary tract tumors also can present with hematuria. But this is not very common. That's why older age, especially age more than 50 years, and the patient having gross hematuria, for example, we have to rule out bladder cancer. Now, we also have to know the hematuria is happening at the initial stream, the terminal stream, which is terminal hematuria, the whole urine voided. Because initial stream hematuria often arise from the urethra, so it can signify mild bleeding from prostatic urethra or the rest of the urethra, while terminal hematuria can arise from problems affecting the bladder neck, and this happens due to a bladder contraction at the end of the voiding. So the bleeding will happen after the bladder contraction. The most important for us in the upper urinary tract is the whole urine blood. So if the bleeding is in the bladder or upward, then the blood will present in the whole urine voided. We have also to ask the patient if he has clots passing with urine. The shape of the clots can refers to the origin, because if clots are forming inside the ureter, there will be a vermiform in shape, and this will give a hint for an upper urinary tract bleeding. Also, we can, in female patients, it's important to rule out infections, because simple cystitis is very common in females. On urine analysis, we can also look for upper tract bleeding, especially from the glomeruli or the kidney, by looking for findings in the urine analysis, such as dysmorphic RBCs or casts, RBC cast or other casts. Finally, I would like to thank you for listening to this part. In next part, we will talk about complete clinical scenarios that can happen with upper urinary tract symptoms.